Hi everyone. This will change your life if you know. Celiac disease is an illness caused by an immune reaction to eating gluten. Gluten is a protein found in foods containing wheat, barley or rye. People have celiac disease, eating gluten, their immune system reacts, causing damage to the lining of the small intestine. Over time, this reaction damages your small intestine's lining and prevents it from absorbing nutrients, a condition called malabsorption. The intestinal damage often causes symptoms such as diarrhea, fatigue, weight loss, bloating or anemia. If left untreated, this condition can lead to severe complications. In children, malabsorption can affect growth and development in addition to gastrointestinal symptoms. There's no definite cure for celiac disease. But for most people, following a strict gluten-free diet can help manage symptoms and help the intestines heal. What are the symptoms of celiac disease? Celiac disease symptoms can vary from person to person, and they can be mild or severe. Some people may not have any symptoms or only notice them later in life. Some common symptoms in children are stomach pain, bloating, gas, ongoing diarrhea or constipation, feeling sick, throwing up, pale and smelly stool, or fatty stool that floats. Celiac disease can also show non-digestive symptoms like losing weight, feeling tired, being sad or anxious, joint pain, sores in the mouth, a skin rash called dermatitis herpetiformis, or nerve problems causing tingling in the legs and feet. The damaged gut in celiac disease may lead to a lack of important nutrients like vitamins B12, D, and K, and sometimes iron, causing anemia. Apart from affecting digestion, celiac disease can harm the large intestine and other organs. The symptoms might be different depending on factors like age, how much gluten someone eats, when they started eating gluten, and how long they were breastfed. Certain situations like surgery, pregnancy, infections, or severe stress can also trigger celiac disease symptoms. Symptoms in children. When kids have celiac disease, their bodies might not get the important stuff from food, and that can cause problems with growing and developing. This can show up as babies not growing well, kids being shorter and growing slowly, losing weight, teeth getting damaged, feeling moody, like being annoyed easily, starting puberty later than usual, having tummy pain or diarrhea. But, if these kids stop eating gluten early on, it can help prevent these issues. The tummy damage can start getting better in a few weeks after removing gluten. Sometimes, as kids get older, they might not have these problems for a while, but they could come back later in life. Causes and risk factors. Celiac disease can happen to anyone, but it's more likely if someone in your family has it. If your mom, dad, or brother, sister has celiac disease, there's a 1 in 10 chance you might get it too. Sometimes, it's more common in people who have other conditions like Down syndrome, Turner syndrome, type 1 diabetes, Hashimoto's, or autoimmune thyroid disease. Researchers also think that a few other things might increase the chances of getting celiac disease, but they're still checking if these are true. These include eating gluten early, having a lot of infections when you're a baby, and having certain genes linked to celiac disease. Celiac disease tests and diagnosis. To find out if someone has celiac disease, doctors look at their medical history and might order some tests. These tests include blood tests and genetic tests, and sometimes a biopsy. In the blood tests, doctors check for specific antibodies that are common in people with celiac disease, like anti-tissue transglutaminase and anti-endomysial antibodies. They might also do a human leukocyte antigen, HLA, test, which looks at certain proteins in white blood cells linked to celiac disease. If these tests show signs of celiac disease, the doctor might do a biopsy. This involves using a thin tube with a camera called an endoscope to take tiny samples from the lining of the intestine. Usually, they take a few samples to make sure they get accurate results. Diagnosing celiac disease can be tricky because it has similar symptoms to other conditions like irritable bowel syndrome, Crohn's disease of the small intestine, Whipple's disease, giardiasis, and side effects of some medications like nonsteroidal anti-inflammatory drugs, NSAIDs. So, it's important to do these tests to get a clear picture. Celiac disease diet. For most people with celiac disease, feeling better happens when they start eating a diet without gluten. You might see improvements in just a few days or weeks. In kids, the tummy usually gets better in 3 to 6 months, but in adults, it might take a few years for everything to heal up. When the tummy is all better, the body can take in nutrients from food like it should. Finding gluten-free food is easier now, especially in some places where there are lots of options. The important thing is to learn which foods and things, like toothpaste, might have gluten. A dietitian who knows about this can be really helpful. Which foods can trigger celiac disease? Gluten is naturally found in wheat, rye, and barley. Many cereals, grains, pasta, and processed foods have gluten. Beers and some alcoholic drinks made from grains can also have it. Checking labels is important because gluten might be in unexpected products. Foods without gluten include meat, fish, fruits, vegetables, certain grains like rice, amaranth, quinoa, and buckwheat, rice flour, and gluten-free labeled products like pasta and bread. You can also remove gluten from recipes by using different ingredients and adjusting baking times and temperatures. In the past, experts said people with celiac disease should avoid oats. Now, evidence suggests that oats are generally safe if they haven't touched gluten during processing. The Food and Drug Administration, FDA, says a food can only be labeled as gluten-free if it has less than 20 parts per million of gluten, which is the smallest amount that tests can reliably find. When traveling, it's important to remember that labeling rules vary from country to country. Many processed foods, like canned soups, salad dressings, ketchup, soy sauce, ice cream, and others, may contain gluten. Non-food items, including some medications, vitamins, toothpaste, cosmetics like lipstick and lip gloss, postage stamps, and communion wafers, can also have gluten. Treatment for celiac disease. For most people, feeling better happens when they stop eating gluten. This helps the intestine heal. If someone has skin issues like dermatitis herpetiformis, a medicine called diamino diphenylsulfone, dapsone, can help with symptoms, but it doesn't heal the intestine. So, a gluten-free diet is still super important. People with celiac disease might also need extra vitamins and minerals to make sure they're getting everything they need. Scientists are working on new medicines to make life easier for those with celiac disease and improve their long-term health. You can find more info about these possible future treatments on the Celiac Disease Foundation's website. What causes celiac disease to begin? Celiac disease is a kind of sickness that happens in people with specific genes. It can start at any age after someone begins eating gluten. When a person with this disease eats food with gluten, their immune system reacts in a bad way and harms tiny parts in the intestine called villi, which affects how the body takes in nutrients. How does it feel if celiac disease is not diagnosed? People who don't know they have celiac disease might feel digestive problems after eating gluten. They could also face other health issues like anemia, losing weight without a clear reason, and not getting enough essential nutrients. Can celiac disease suddenly appear? You might have a higher chance of getting celiac disease if someone in your family has it. But, it can still happen to anyone, no matter how old they are, after they begin eating gluten. Summary. Celiac disease is when the body's defense system mistakenly attacks the cells in the small intestine when we eat gluten. While there's no cure for it, a person can make their symptoms feel better by changing to a diet without gluten. Thanks for watching.